Namaste everyone. I am Neha Gupta, student of MBBS first year. Today we are going to study about the bone called femur. This is the femur. The femur is the longest and the strongest bone of the body. It has an upper rounded end, a long shaft, and in the lower a bicondylar end. The shaft is convex forward. The head forms more than half of a sphere and it is directed medially, upwards and slightly forward. It articulates with the acetabulum forming the hip joint, and it has a central pit called fovea. About the neck connects the head with the shaft. It has two borders, upper border and the lower border. Upper border is concave and horizontal and it meets the greater trochanter. The lower border is oblique and it meets at the lesser trochanter. This is the left femur. Therefore, it is the medial border. It is the lateral border. The head makes an angle with the shaft called the neck shaft angle, which is about 125 degrees in adults. Now let us see about the greater trochanter. So it is a quadrangular prominence located in the upper part of the junction of the neck. The greater trochanter has an upper border with an apex and three surfaces: anterior, lateral and medial surface. The apex is actually the interned posterior part of the posterior border. The medial surface of the greater trochanter presents a rough impression above and there is a trochanteric fossa below. Now talking about the lesser trochanter, so it is a conical eminence and it is directed medially and it is present posteriorly. That is the posterior inferior part of the neck with the shaft. This line joining the greater trochanter with the lesser trochanter is called the intertrochanteric line. This is the intertrochanteric crest, which marks the junction of the posterior part of the neck with the shaft. This is intertrochanteric crest. Here we can notice a rounded elevation in the intertrochanteric crest, and this is called the quadrate tubercle. Now let us study about the shaft. So the shaft is convex forward. In the middle 1/3 of the shaft has three borders, that is the medial, lateral and the posterior border, and has three surfaces: anterior, medial this side, medial, and lateral this side, lateral. The posterior border is in the form of roughened broad ridge called the linea aspera. It has two lips. This is the medial lip, this is the lateral lip. The two lips diverge at the bottom, and at the lateral side this lip forms the lateral supracondylar ridge, and at the medial side this forms the medial supracondylar ridge, medial supracondylar line and lateral supracondylar line. The lower end of the femur is expanded to form two condyles, the medial and the lateral. In the anterior aspect, the two condyles are united. Posteriorly, they are separated by a deep gap called intercondylar fossa. In the lower border, we have four surfaces: anterior, medial, lateral and popliteal surface. On the medial condyle, there is a projection called the adductor tubercle. Now let us study about the muscle attachment on the femur. The fovea on the head of the femur gives attachment to the ligament of the head of the femur or round ligament. The muscle attachment on the greater trochanter, starting from the apex of the superior border. This apex provides attachment or insertion to piriformis. This is the anterior surface of the greater trochanter and this is the lateral side, which provides insertion to gluteus minimus muscle. On the medial surface, on the upper area, it gives insertion to obturator internus muscle with the two gemelli. Obturator externus is inserted into the trochanteric fossa. And the lateral surface, there is a ridge which gives insertion to gluteus medius muscle. Let us revise. The apex gives attachment to piriformis. Anterior surface, lateral side gives attachment to gluteus minimus muscle. On the lateral surface of greater trochanter, this is the gluteus medius muscle. In the rough impression on the medial surface gives attachment to the obturator internus with the two gemelli and the obturator externus also. Let us see this diagram for clear understanding. The apex gives insertion to piriformis, then gluteus minimus on the lateral part of anterior surface, gluteus medius on the lateral surface, and obturator internus with the two gemelli and obturator externus in the medial surface. Now let us see the muscle attachment on the lesser trochanter. So the apex, this is the apex. Apex gives insertion to psoas major, and the base gives insertion to iliacus muscle. This is the intertrochanteric line, and this gives attachment to ligaments like capsular ligament, iliofemoral ligament, upper band and lower band of iliofemoral ligament. In the intertrochanteric crest, there is a rounded elevation. This is called the quadrate tubercle, which gives insertion to quadratus femoris. Now let us see the attachments on the shaft. This is the vastus intermedius muscle, which arises from the upper 3/4 of the anterior and the lateral surface. Vastus lateralis muscle arises from upper part of intertrochanteric line. Then anterior and inferior aspects of the greater trochanter, lateral margin of gluteal tuberosity, and the upper half of the lateral lip of the linea aspera. Vastus medialis arising from the medial lip of linea aspera. Gluteus maximus muscle inserted in the gluteal tuberosity. Adductor longus muscle is inserted along the medial lip of linea aspera. Then the adductor brevis is inserted along the line extending from the lesser tubercle till the upper part of linea aspera. Adductor magnus inserted along the medial side of the linea aspera. Pectineus muscle is inserted on a line extending from the lesser trochanter to the linea aspera. The short head of biceps femoris arises from the lateral lip of linea aspera